Hello everyone. My name is Mrs. Mathaumkoba. I'm a biomedical technologist, and today we are going to learn about few clinical equipments that they are very prone to breakdown, and we are going to see how they work and the parts that they are very prone to those breakdown. So before I start handling any equipment, we have to observe safety measures. So in case you don't have a sterile gloves like the one I've put on, we're going to use a sterilizer. It's the common spirit, most commonly known as methanol. So it's just to sterilize your hands and sterilize some of the equipments that maybe you're going to work on them. Now, so our first equipment is a diagnostic equipment. It's a thermometer. This kind of a thermometer is called a gun thermometer. A gun thermometer, it's commonly known as infrared thermometer, and it works by detecting the infrared radiation emitted by an object. So the device contains a lens that focuses the infrared energy on the object. For example, now I'm the object that I want to get to know the temperature. So you focus, it has a lens, and the lens is one of the parts that is prone to break down. The buttons and the switch. So those are parts that they are commonly broken down and they might need repair. Another clinical equipment that is it's also common is a stethoscope. A stethoscope it works based on transmission of sound waves, and the key components are the chest piece, which is here. Then we have the tubing, and the earpiece. So this stethoscope, as a biomedical technologist, you see, like, one of the common parts that it can have a breakdown or fault is the tubing. Maybe the chest piece is not fixed properly on the tubing, so it might give faulty readings or faulty information to the medic trying to examine the patient. Another equipment that you're going to look is the pulsimeter. The pulsimeter is purposely or commonly used to examine the patient's pulse, if the pulse are normal, or they're higher, or they are lower. And if we can just show you, the equipment is just a very small thing, and as you can see, it can break, or maybe the wire, like the parts that they are wired, can have fault. And that's all about the pulsimeter. Another equipment that's also used in clinical as diagnostic equipment is a BP machine. Now, we have different types of BP machines. There are two major types. The manual, like the one that today I'm going to show you in my session, is the manual one. Then there is a digital BP machine. So that's how my BP machine looks. For the base, it is improvised. Okay. So I'll just show you the major parts. We have the handcuff, then the tube, and the reading part. So the most prone part that it can mainly fail is the tube. Maybe we have a crack. Yeah, maybe it's the hair hole, it's not closed well, and maybe the handcuff has worn or it's torn. Yeah, you can't get an accurate blood pressure reading. So those are the few diagnostic equipment that I've shown you today in today's session. The next session we look at the other equipments like microscope, and on sterilization you can look at an autoclave, the different types of an autoclaves obviously, and I'll deal with the most simpler and the one that are common. I hope you enjoyed today's session. As I said, my name is Martha Nkoba, a current student in KSTVET, pursuing DTE, that is Diploma in Technical Education, Medical Engineering option. Thank you.